Yeah, we're good to go.
All right. Welcome back, everybody. I'm Tracy Hoke. I'm the Chief of Quality and Performance Improvement at the University of Virginia, and this presentation is entitled Caring for Virginia's Caregivers. It is a panel presentation, and I will introduce our panel in my remarks to come. It's been a year since we were all together and had our first statewide discussion about the relationship between clinician burnout, clinician well-being, and achieving our quality and safety goals. Since that time, many efforts and initiatives have been underway in Virginia hospitals and health systems to address these important topics. I had the privilege of co-chairing a statewide task force with Dr. Joel Bundy from Centera Healthcare that was charged by the VHHA Board of Directors with developing and recommending organizational and industry-wide interventions that support a systems approach to reducing clinician burnout and fostering professional well-being in Virginia's hospitals and health systems. Additionally, many of you gathered virtually on a monthly basis to hear Dr. Brian Sexton from Duke University to speak to us in his monthly well-being webinar series. Thank you to the VHHA for making this available to all of us. We will start our discussion this morning with a brief presentation from Dr. Sexton, who will share with us some of his insights and recommendations regarding burnout among healthcare providers. Following Dr. Sexton's presentation, a few of the members of the VHHA Board of Directors Caring for Virginia Caregivers Task Force that Dr. Bundy and I led will review the work of the task force and the recommendations that were made to the VHHA Board of Directors. We will conclude our discussion this morning with an update of the work of the Dr. Lorna Breen Heroes Foundation. As some of you may recall from last year's summit, Corey and Jennifer Feist of Charlottesville shared with us the tragic story of the death of their sister, Dr. Lorna Breen, during the early days of the COVID-19 pandemic, and the work they were initiating to help other healthcare providers suffering from the emotional and mental stressors amplified by the COVID pandemic. The foundation they have created is dedicated to reducing burnout of healthcare professionals and safeguarding their well-being and job satisfaction. Corey also has some exciting news to share with us, and be sure to stay with us to hear his remarks. At this time, I would like to introduce and welcome back to Virginia, Dr. Brian Sexton.
Thank you, Tracy, and thank you all for joining us today. Who doesn't want to hear about emotional exhaustion during a global health crisis? To quote our Surgeon General, if healthcare providers aren't well, it's hard for them to heal the people for whom they are caring. If you don't mind, I'd love to take you on a quick kind of mental journey. Imagine that we were all together in a hotel ballroom, and there's going to be a mediocre lunch, and there's going to be decent stuff being shown on the screen in front of the room, and we all walk into the room and find our seat. Some of us want to sit in the back, some of us at the front of the room. Just imagine that you're doing this. But in this particular situation, in this scenario, half of the tables, the table rounds where you're going to go and find your place, half of the tables have one sign on them, and the other half have a different sign. Now, all of the tables have a bowl of freshly baked chocolate chip cookies, and all of the tables have a bowl of radishes. But half of them have a sign that say you can eat the cookies, but not the radishes. And the other half have a sign that says you can eat the radishes, but not the cookies. And then you have to go through a long, grueling day of continuing education, blardy, blardy, blar. Hopefully it's entertaining. Hopefully you learn something you can take home. Hopefully it was worth your time finding parking, all that stuff. But what's interesting is this is an actual psychological experiment that we run on participants in a variety of different kind of iterations of what I just explained. And what we're trying to do is to get people to use up their willpower while they sit there doing something else. Now, the folks who were told they could eat the cookies, at the end of a long day of continuing education, they still have a relatively fully charged willpower battery because they didn't have to not do something that they wanted to do. The folks that were told they could eat the radishes but not the cookies, well, they've been trying to not think about cookies all day long, and it's been top of mind. Now the really nefarious part of the study begins, because while this was a challenge to available willpower, what next happens is they give everyone the people at the cookie eating tables and the people at the radish eating tables a puzzle. And it's a puzzle with no true end. And the real part of the study is they look to see how long do people persist in something that's difficult before they give up, after you've used up all that self-control and willpower. And what they found, interestingly, was that the cookie eaters persevered for 19 minutes on an impossible task, whereas the radish eaters persevered for 8 minutes. I just want you to think for a minute about how you feel after a long, busy day, after difficult interactions with family members and patients, and after meetings and working on projects and rushing around. Do you still feel like you have the energy to work on your goals? And after a long day, do you really prioritize your well-being? Most of us just want to veg out in front of YouTube or TV and avoid doing anything at all. And the reason that you might find yourself so exhausted and burned out after a hard day, especially during Omicron, can be influenced by what psychologists refer to as the ego depletion effect. So ego depletion is this idea that self-control or willpower draws upon a limited pool of mental resources that can be used up. And when your energy for mental activity is low, self-control is impaired. We're using our self-control during COVID-19 and during political unrest and during disruptive patients and disruptive colleagues, and it uses up our reserves faster than we realize. And I just want to kind of reframe well-being a little bit. Now, what do you do with the cookie scenario? Well, have a cookie for once. They've also done this with celery and M&Ms, and they find that if you just take the bowl of M&Ms and you put it in a drawer and you shut the drawer, it's out of your sight, out of your field of vision. It doesn't activate and use up that same amount of willpower. So don't make tempting things quite so tempting is one thing you can do. But I really want to help to redefine what we mean by well-being. Usually people think of well-being as happiness. And so if I'm doing fine with well-being, it means I'm happy. And I'd like to reconceptualize that. Well-being is something else. Let's talk about that. And the question that we get very frequently during the pandemic is, how on earth am I supposed to improve my well-being during a global health crisis? Well, let's go back to this redefinition of well-being. We believe it should be more about your ability to do stuff. Your well-being is your ability to do stuff. And so as your ability to do stuff is compromised, your well-being is compromised, and vice versa. So that's why we see with compromised well-being, our patient outcomes suffer, our clinical and operational outcomes suffer, our interactions with our loved ones suffer, our parenting suffers, when we have compromised well-being, because it's overarchingly our ability to do stuff. Now, I'd love to share with you an update about where things are with well-being before and during and currently in the pandemic, and we have some new data that I'd like to share with you all. Now, to talk about the impact of COVID-19 and the evidence that is there that we can actually fix it, I'd like to share with you some data that we've collected from 30,000 healthcare workers. Now, we had a bigger sample of 50,000, but we only had it for 2 years. Now we've got 30,000 people for 3 years. This is September of 2019, in September of 2020, so during the pandemic, but before the vaccines, and in September of 2021, in going all the way into January of 2022, so very recent. So after vaccines and after Delta and even part of Omicron is reflected in that. So let's look at 2019, 2020, and 2022 in that way. Maybe it's not surprising that, yes, emotional exhaustion, our ability to do stuff has really taken a hit. Our emotional exhaustion is up. So we are more exhausted in 2020. And in 2021, we're very, very exhausted. Now, if you look at this data broken out across 30,000 people by different roles, there are different trajectories for our nurses than there were for our physicians. So nurses, their biggest hit to their well-being took place in 2020, right? In 2020, they were hit really hard with unbelievable volumes of things to do and new things to do, and not having what they needed to do it. The physicians, on the other hand, actually saw their emotional exhaustion decrease during 2020. For the first time, they had a decrease in their volumes. A lot of them did. Not physicians working in COVID units, but physicians on average, dermatologists and others, on average, they saw a decrease in their volumes, decrease in EMR use. They saw more flexibility. I have a very good friend who's a radiologist who, for the first time in his career, could work home 3 days a week, work from home and have lunch with his spouse. That was unheard of until the pandemic. Now that's gone. So our physician colleagues saw an enormous jump in their emotional exhaustion in 2021, an enormous jump associated with Delta and Omicron. They're catching up to everybody else now. So when the pandemic unfurled in front of us, it hit different groups of people in different ways. If you want to see what this looks like by role, we saw this, basically emotional exhaustion got worse for everyone by 2021, but between 2019 and 2021, there were some different trajectories. Social workers, it just continued to get worse. For administrators and managers, emotional exhaustion just continued to get worse. For nurses, what's interesting is they saw their really big jump in 2020, and it continued to get worse in 2021, but it was already pretty bad in 2020. And then for our physician groups, they went down, right? Here's non-employed physicians, residents, very, very different trajectory. And you can see any line chart here that goes down is one of the physician groups, just to show you what that looks like. Now that's everybody that we have from a big 30,000 person sample. Let's take a look at what we know from Virginia. And so we collected these data, and we've shared these before. There were 654 folks from Virginia who participated in our baseline well-being assessment, and their emotional exhaustion rate was 60%. Now, I just showed you before emotional exhaustion rates that are about 45, percent, almost pushing 50% there. Here it's 60%. So the emotional exhaustion rate in Virginia was already really high at the beginning. And we had, of these 654 people, a little over half, about 62% of them actually enrolled in our 3 Good Things intervention. And so you might find it interesting that those who decided to enroll in the 3 Good Things intervention were the ones that were they had even more emotional exhaustion than the Virginia folks on average. Just 3 out of 4 folks from Virginia who enrolled in our study who are really struggling with emotional exhaustion. But we now have the 1 month post from them and the 6 month post. And it's interesting to say that by 1 month later, we had a massive reduction in the burnout from the folks that participated in one of our interventions. 6 months later, after that, burnout is up, but it's still way down from where it was when it started. And this difference is very, very significant in terms of statistically significant. Once you find in a big group of like this, kind of a 5, 6, 7 point difference, it's going to be different. This is an enormous, almost 30-point difference. This is very significant. But we lost some of the ground that we gained through Delta. The Delta variant hit the people, even the ones that were getting some relief using some of these resources. They still it hurt them, but they're still doing much better than they were at the beginning. Now, we know that burnout is bad. And I just want to say, as much as burnout is intense right now, we can cause it to go down. And we have at the ready these bite-sized strategies. This time right now is not the time to do meditation or yoga or train for a marathon. Those require initiation energy that just isn't there. And you may ask whether these bite-sized strategies are effective. And we've actually shown this, not just using data from Virginia, but using randomized controlled trials, showing that we can cause emotional exhaustion to decrease and stay decreased. We can cause problems with work-life balance to decrease and stay decreased. And I'll show you what we do on our well-being webinar sessions that we do, is we pose and then answer significant questions. And all you need to do so is a mobile phone. So if you have a mobile phone, you have a camera, we put up a QR code, you can scan it, just put your phone in camera mode, you scan it, and that gives you access to the resources that we talk about during the webinar. If you don't have a camera on your mobile phone, you can just type it in, bit.ly, and then type in the tool. We have a lot of these tools. Here are the top 10 tools that we share during the pandemic. They include things like how to cultivate hope, how to build relationships, how to work on your work-life balance, how to work on your sleep, how to use self-compassion. That's a really fun one. Anybody who wants to do something simple, a 7-minute dose of self-compassion has a significant impact on your well-being within 1 week. A significant impact. So just a 7-minute dose. That's why we call them bite-sized. All of these tools and more are available on our website. We have a whole litany of things for individuals to do, that's on the right-hand side, and for institutions to do, that's on the left-hand side. Peer support, second victim support, emotional support, rounding, positive rounding, patient safety rounding. All of those are different options that you can engage in. And with that, I just want to say there are resources out there. You can check out these and more at hsq.dukehealth.org, or you can check out any of the many recordings that Christy has made available to everyone throughout Virginia of the well-being sessions that we do every month with members of the Virginia Health and Hospital Association. And with that, I'm going to yield back my time and say thank you for letting me share this with you today.
Brian, thank you so much. Thank you for your work, for your presentation, and for making these resources available to us. We appreciate it. At this time, I would like to introduce a few members of the VHHA's Caring for Virginia Caregivers Task Force that met last summer and made recommendations to the VHHA Board of Directors this past fall. We were fortunate to have representatives from many Virginia hospitals and health systems serve on the task force, as well as representatives from the Medical Society of Virginia and the Virginia Nurses Association. This afternoon, we have with us Dr. Tiffany Nide of Centra Health, Ms. Linda Shepard with the Virginia Nurses Association, Dr. Joel Bundy with Centera Healthcare, and Mr. Corey Feist of the Dr. Lorna Breen Heroes Foundation. We will start our discussion with Dr. Nide, who will speak about the task force's emphasis on the importance of executive leadership and system-wide joint accountability for systemic transformation in the 3 basic categories for a well-rounded approach.
Great. Thank you so much, Dr. Hoke and Andy, for pulling up the slides for me, please, when you have an opportunity. Good morning, everyone. I'm Dr. Tiffany Nide, Medical Director for Clinician Wellbeing at Centra Medical Group. It's really a pleasure to be here with you all, and was really a wonderful opportunity to serve on this task force, coming together with leaders across the Commonwealth to work on this very important topic. We recognized, as do the expert guidelines, that an important first step in this type of system transformation is having a formal written commitment to caregiver well-being and professional fulfillment. So we worked blending the expertise of the group with reviews of the literature to create one that could be shared throughout the Commonwealth to really unite us in this work. We started by using the quadruple aim to build a strong consensus on why this system transformation is so imperative. First and foremost, caregiver well-being and fulfillment is integral to the healthcare mission of caring for people. Working in healthcare is an extremely rewarding calling. However, as we all know, particularly over these past couple of years, it's also a uniquely challenging environment, and it leads to well-documented increases of chronic stress, burnout, unmet mental health needs. And it's really imperative that as a system, we do all we can to prevent and address these issues. To truly thrive, our caregivers need to be healthy and able to connect to the meaning and joy in the work that they've been called to do. And perhaps one of the most important roles for a leader is to foster this and remove those barriers that get in the way. Now, we're all here today focused on resilience because we know the research is clear that the well-being of our caregivers also directly impacts our patients. Caregivers aren't able to perform at their best or provide the same level of compassionate care when they themselves are suffering. They're more likely to make a medical error. In fact, up to twice as likely. Patients experience negative health outcomes, including longer recovery times, readmissions, and higher mortality rates. Patients are less likely to recommend that caregiver or facility to others, and less likely to follow through on the medical recommendations that they're given. So caregiver well-being is clearly integral to our focus on quality, safety, and patient experience. The well-being of our caregivers also directly impacts the resiliency of the entire organization. Unwell or burnt out caregivers can significantly affect the morale, teamwork, efficiency. We can see an average of 14% decrease in productivity and an increased cost of care due to higher rates of medically unnecessary diagnostics and referrals. Further strain on an already taxed workforce and our ability to meet community access needs, as our caregivers may need to reduce hours or leave practice for their own self-care. The cost of turnover alone is tremendous. Just one example for physicians, $500,000 to over $1 million to replace just one. So caregiver well-being is integral to our ability to continue on as sustainable, efficient healthcare systems that can meet the needs of our communities. Next slide, please. We also acknowledge that success here requires system transformation and joint accountability throughout the organization. The World Health Organization defines burnout as an occupational phenomenon, a result of chronic work stress, not a personal resilience deficit. In fact, the literature shows us that most of the drivers, those root causes, are directly related to our work environment and culture. We can only move that needle from unwell to thriving by addressing these drivers in all 3 areas. As leaders, we can continue our work towards creating safe, healthy, rewarding, and inspiring environments. It's been incredible to see how we've risen up together to meet these challenges. There's great work done throughout Virginia and beyond, along with evidence-based interventions and guidelines that can support us on our way. So we distilled a few key examples in each category as inspiration for our continued work. Ways to support fostering a culture of wellness, of breaking that cycle of suffering in silence, where practicing self-care and reaching out for support is modeled by our leaders and celebrated as signs of wisdom, courage, and strength. Strategies to identify and address those common processes, practice inefficiency, those pebbles in the shoe that get in the way of a great day fulfilling our purpose. To offer a wide variety of individual supports to address mental health and boost resilience, to foster growth and development, and ultimately to reconnect to the joy and the meaning in our work. Next slide, please. Lastly, we want this document to be more than just a thought exercise, but to be a true call to action, to celebrate some of the great work already underway, to formally commit to continuing this journey of system transformation together, partnering as leaders with each other, with all of our dedicated caregivers throughout the Commonwealth, even the nation. I'm thrilled to say so far we have at least 19 Virginia organizations who've already signed on. So I look forward to our continued united front, each of us empowered to make important contributions in our own way, together fostering a healthcare environment where we can truly thrive, taking great care of ourselves, each other, our patients, and our community. So thank you so much for your time and commitment, and back to you, Dr. Hoke.
Tiffany, thank you so much for your work and thank you for that presentation. We appreciate it. We will now move on to Linda Shepard, and I ask her to share her insights from the past year as a member of the task force and from her role as the president of the Virginia Nurses Association.
Good morning, everyone. It's an honor to be here today and to be part of this panel discussion. In reflecting over the past year, we continue to recognize the mental health needs of healthcare workers as significant public health concerns and its impact on care delivery in terms of quality of care, patient satisfaction, turnover, and healthcare cost, as all have been impacted by the emotional cost of caring. For nurses, particularly, the impact of the pandemic has accelerated the migration of nurses away from the acute care bedside and other areas and environments, leaving the profession accentuating the nursing shortage, which actually began in 2012. On a state level, as we look at this and as I continue to talk with nurses from around the state, many issue concerns pre-COVID regarding pre-existing unhealthy work conditions, earmarked by heavy workload as the result of staffing challenges, high-paced environments, lack of environmental control, and mandated overtime. In turn, the pandemic has only accelerated these existing conditions, accelerating burnout among nurses and other healthcare workers. Through multiple VNA platforms, nurses continue to share their growing concerns regarding increased stress brought on by excessive workloads, mounting demands from patients, families, and other entities, ongoing accelerations and alterations in clinical roles and responsibilities, deployment, lack of expressed value congruence, physical and psychological safety concerns, inclusive of workplace bullying and violence, and perceived pressure to cope and be resilient amidst feelings of extreme moral injury, trauma, and exhaustion. In a survey that was performed on targeting RNs regarding intent to stay, actually it was performed back in August of 2021 by the American Nursing Foundation, the following was revealed. 50% of nurses expressed intent to stay in their positions for only the next 6 months. 21% intended to leave, and 29% reported they might leave. And of those under age 35, 31% indicated the intent to leave. For all ages, intent to leave was driven by 3 domains: mental health, staffing, and organizational issues. The survey actually looked at over 13,000. Self-reported burnout among this group had increased by 350% since the initial survey performed back in June and July of 2020. Correspondingly, over 1/3 of all nurses in the US are now 55 years or older, while the younger nurse force replacing these individuals struggled far greater disproportionately with mental health issues. Data reflects that those under age 35 suffer from elevated stress and depression, anxiety, trauma, and lower emotional health and resiliency scores, while expressing a higher intent to leave a job that would exacerbate their stress. Further, nurses struggle with obtaining help. And actually, from the nurses that we spoke with, many of them cited concerns of stigma, confidentiality, and retribution by employers and licensing boards for not obtaining mental health services. As nurses continue to struggle, part of the stigma that we have heard and has been associated with the profession is, quote unquote, nurses need to just deal with the mounting difficulties of the job. If they need help, perhaps they're not cut out to be a nurse. And yet, while the intent is honorable, nurses also struggle with being identified as healthcare heroes, reinforcing the feelings among already physically and emotionally exhausted nurses. They're expected to be resilient, thus discouraging them further from seeking help. Over the past 2 years, the ANA and the VNA, along with other organizations, have worked to create programs and resources for healthcare workers targeted at education and promoting and supplying tools and support to encourage professional well-being. The VNA initiatives have included programs such as engaging in extreme self-care for extreme times and addressing clinical mental health through evidence-based practice strategies. Conferences have focused on coaching strategies to promote health resilience and recovery beyond burnout and bullying, addressing occupational stress, and fostering recovery by creating moral community in the midst of a pandemic. In addition, the VNA Workforce Commission continues to focus on diversity, equity, and inclusion, incivility and violence in the workplace, staff issues and innovations, and healthy work environments, The VNA Nurse Leadership Academy incorporates education on well-being practices and promotes leaders' exploration and adaptation of evidence-based practices to support the well-being of their teams. VNA continues to advocate for education on the topic of professional wellness and resilience within academic settings as preparatory for nurses entering the workforce. In addition, the VNA and VNF continue to focus on improving the health of our communities through Virginia, specifically in regards to mental health and health equity. The VNA, VNF, and its collaborative partners, including the ANA, VONL, VHHA, academia, public health, and many other entities, continue to assist the organization in its work to help nurses rediscover the joy and passion of their profession. In turn, this body of work aligns with the strategies and outputs targeted by the ANA and the VHHA's Caring for Virginia's Caregivers Task Force as we move the dial to reduce burnout and shared trauma from the individual to the organization, as attrition continues to grow to be a growing concern among healthcare workforces. As an organization, all are in varying stages of their journey, and the need needs to be vigilant in fostering a culture of wellness and prioritizing psychological well-being, not only as a priority, but a strategic investment. Thank you.
Linda, thank you so much. There was a question in a chat because we had a tiny issue with the video. Could you repeat the 3 domains that are driving the exit of nurses from the workforce?
Oh, absolutely. So it is staffing, it is workplace organizations, and mental health challenges.
Perfect. Thank you. I just wanted to get that into the recording.
Sure.
All right. At this time, I would like to call on my colleague, Dr. Joel Bundy. Joel, it was a pleasure to chair the task force with you. Could you speak to your insights from the past year and summarize some of the industry-wide recommendations that the task force asked the VHHA Board of Directors to focus on?
Absolutely. Let me just get everything squared away here again. All right. Good morning, everybody. This is Joel Bundy. Thank you, Dr. Hoke, for working with me over the past year. This is something that many of us are very, very passionate about. And we, as members of this task force, we met for many months over the summer. We started back in April, and then we reported back to the board in November. We had 18 members, 18 representatives from across Virginia that were representing our hospitals and systems, also including the Medical Society of Virginia. We had people from actually Corey from the Lorna Breen Heroes Foundation, the Virginia Nurses Association, and we were looking for things about wellness, and more importantly, we're looking for solutions. And again, Tracy, thank you so much for co-chairing this with me. You can see on the slide that we had various themes that we were concerned about. Those themes were really about burnout and the impact of burnout on quality and safety. And many of us have read the Pennsylvania Nurses Study looking at HAIs and the relationship between those infections and people who had burnout. And we also recognize that staffing has to be part of the solutions, and that this isn't new. We've been talking about this for years. And yes, we've been listening to Dr. Sexton, reading his studies. We've been looking at the Medscape Physician Burnout Report for many years. And we saw what Dr. Sexton presented a few minutes ago, but that study, that Medscape study looked at that burnout worsened by 5% for physicians in 2021. And there was a recent AMA survey that was published just in December in Mayo Clinic Proceedings. It showed that 1 out of 5 physicians are contemplating leaving the workforce in 2 years, 1 out of 5. And that 2 out of 5 nurses are intending to leave. That is a tremendous number of people that are looking at leaving in just the next couple of years. We know that we have solutions, but they're not really utilized. A big example is, physicians tend not to use EAP programs. So what are we going to do if they don't use those EAP programs? And then there's a stigma associated with utilization. I saw that in the chat about stigma. And so there are programs that are now out, such as Safe Haven, where clinicians, physicians, and nurses can actually look at those programs and actually go and talk to people without the concern about being immediately reported to the Board of Medicine and maybe losing their license. And to put a point on what Dr. Sexton said, it's not just about doing yoga. Individual resiliency is really important, but we have to build, and that the people on this call today, we're the leaders of our organizations. We have to build a more efficient and a joyful place to work with a positive culture. And we have to look at practices that support such organizational resilience. And Dr. Sexton said that if well-being redefined is the ability to do stuff, I would say that one of the things that we have to do is getting rid of stupid stuff, wasteful EHR tasks, and aligning our EHRs to match clinical workflows. That's incredibly important. And all of us can think of multiple interventions such as these that we just need to implement. And finally, we recognize that we, the people here today, we have to be better communicators, and we have to be better listeners to those at the sharp end of care. So what were our recommendations to the board? Staffing concerns have been worsened by the pandemic, as we all know, and we need to continue to implement recommendations from the 2020 Workforce Advisory Council. We have to continue to work on removing harmful language regarding mental health treatment on licensure applications in Virginia. And I appreciate the Medical Society of Virginia and their work on this. And this is work that's ongoing, but I think that's very important. We need to actually address reductions in administrative burdens, things such as prior auth, trying to reduce those regulatory burdens as best we can. And we have been engaging with various regulatory and legislative bodies to try to do that very thing. Another type of necessary burden is the EHR itself. And how can we improve that? Sometimes we think about, well, we'll just add a best practice alert, click, to try to improve patient safety. But a lot of those are ineffective and they're inefficient, and multiple clicks add up over the day. And finally, we need to share with each other. We don't compete on patient safety, and we will not compete on wellness for our caregivers in Virginia. And that is a full stop. We will not compete. Many of us in our hospitals and health systems and other professional societies, we've been working on wellness for many years, and our task force recognized that. I think that the work on wellness accelerated during the pandemic, and in part that was out of need. Some of the things that we've done, we have now a VHHA webpage on caring for the caregivers. Just this month, the VHHA hired a director of workforce initiatives to try to help us with this, to give us support. We've had the monthly Duke webinar series with Dr. Sexton and Brian. Thank you so much. That's been incredibly important and beneficial to many of our members. We're finishing a well-being assessment tool resource guide that's going to be on the VHHA webpage for all of us to look at and to use as a guide. And then for shared learning opportunities regarding electronic health records, we've had preliminary discussions with representatives from Epic regarding potential opportunities for shared learning with Virginia hospitals within the confines of the Virginia PSO. And of course, this very summit with its focus on resiliency. And I'll finish by saying I'm very proud to be part of these efforts and to stand with each of you today to imagine, to make Virginia a place that provides resilient workplaces that promote joy in practice and work. Thank you, Dr. Hoke.
Joel, thank you so much. It was such a pleasure to work with you and everyone from the task force this summer. At this time, I would like to share with you a brief news clip that aired on CBS News just last month. In this clip, Mr. Corey Feist provides an update on the work that he and his wife, Jennifer, have been engaged in with the Dr. Lorna Breen's Heroes Foundation since last year. After the clip, Corey will join us to elaborate on his comments and to share with us some exciting recent developments and what he believes the future looks like in regards to support for caregivers.
This latest coronavirus wave is putting more pressure on an already drained healthcare system. It's also causing an unprecedented mental health crisis. Studies show doctors and nurses are nearly twice as likely to die by suicide as people in other professions. New landmark legislation has been passed in hopes of changing that. The bill is designed to help address the mental health needs of healthcare workers. Corey Feist is here to discuss that. He is the president and co-founder of the Dr. Lorna Breen Heroes Foundation. That's a nonprofit that lobbied for the new legislation. Thanks for being here. So the pandemic has obviously highlighted the struggles that healthcare workers are having. What are they going through right now in this current surge?
Before the pandemic, our healthcare workforce was already starting to see elevated rates of burnout, depression, as you noted, twice the suicide rate of the normal public. Now what they're experiencing, now we have 55% of the healthcare workforce which is burned out. 60% have said that the pandemic has harmed their mental health. Heightened levels of exhaustion by nurses, as you showed in that prior piece. And only a third of them feel like their employers care about their mental health. So what we have right now is we have a tsunami of mental health trouble for our entire healthcare workforce, which started this pandemic in a highly burned out state. And then most of those people, or I should say at least half of those individuals, don't feel like they can get the mental health treatment that they deserve or need because of fear of professional repercussions, either on their license or culturally in their institutions. We've got this huge sector of our workforce, which we've now sent off to war, and we have got to support their mental health as they continue this fight for us.
What are your biggest fears as we find ourselves in this avalanche of new cases, new hospitalizations, and apathy in the public?
Well, as you just say, the apathy in the public is huge. And in your prior segment, you showed this workforce walkout. I mean, my biggest concern, frankly, is that we won't have a healthcare workforce intact to take care of COVID patients as well as any other patient. You know, recently I heard from a health system that had 50% turnover in its nursing in the emergency department, and they were shifting workers and nurses out, just like in your prior piece, out of non-emergency room shifts to emergency room shifts. And that has a catalyst effect, or a catalytic effect, which really will impact the way that we deliver care to all those in need. So folks need to understand this is not just about taking care of COVID patients. This is taking care of all of us.
Oh. So tell us, why do so few healthcare workers actually seek help? Because that is part of the struggle that your organization is trying to help overcome.
Absolutely. And you've really got two main things here. You've got a cultural issue and a regulatory issue. Culturally, these are healers. They are taught to take care of others before themselves. In fact, if you think about the career trajectory, the length that it takes just to become a doctor, you have to decide very early that this is the path for you, and you consistently delay your own self-gratification, if you will, or things for yourself before those of others, because this is your calling. In addition to that, you have these regulatory barriers. We published an article in U.S. News and World Report on the 9th of September that identified 6 of these. Many of them are questions that frankly violate the Americans with Disabilities Act, but are found in things like state licensure applications for a license to practice medicine or a license to practice nursing. Those kind of barriers exist across the country. And in some cases, like in Dr. Breen's case, the myth about the barrier is actually greater than the actual barrier itself. In other words, they may be wrong about it. In Dr. Breen's case, she thought she was going to lose her medical license. And this is one of the things that she articulated to us before she took her life in April of 2020. She thought she was going to lose her medical license in New York State, and she was incorrect about that. But the myth and just the culture around not being able to prioritize your own health, let alone your mental health, is just pervasive across the healthcare industry. And it's obviously one of the main things that we're working on trying to resolve in our foundation.
I'd like to welcome Corey Feist to the summit. Thank you so much for your work. That clip is sort of sums up the story as it stood at the time, but there's more to tell. Tell us what you've been up to.
Just hanging out, surfing the internet, you know, the usual stuff, Tracy. No, it's wonderful being with you. And I just want to pause for a minute and thank the Hospital Association, Medical Society, and Nursing Association for coming together again to talk about the critical nexus between the well-being of the workforce and patient care. So I just want to acknowledge that and say thank you so much. We've been up to a lot. The first thing I think we're going to do is we're going to take a brief moment and celebrate a historic win for the healthcare workforce, which is the passage of the Dr. Lorna Breen Healthcare Provider Protection Act. My voice cracks when I say that, just because it's been such a journey for us. In less than 2 years, we have now gotten officially passed by both chambers in the House and the Senate. First of its kind legislation in the Dr. Lorna Breen Healthcare Provider Protection Act, which goes to support the well-being of the healthcare workforce. Never been done before, and we're just absolutely thrilled that that's occurred. In fact, that provides $140 million worth of new programs for hospitals and health systems. We're greatly appreciative of the Biden administration, including the funding for this, and it's in the COVID package called the American Rescue Plan, which was actually implemented about a year ago, almost exactly. And so many of the funds have actually already been allocated, including to 3 Virginia health systems, VCU, UVA, and George Mason. So really thrilled about this. But you know, the work from a policy perspective has just begun. Just in case anyone was interested, next week we anticipate the president will sign that law. And look out for mention in the State of the Union address on Tuesday evening, because we believe it will be included there if the conversation around the Ukraine doesn't dominate that State of the Union. But we're just incredibly appreciative, and we know that it is a starting point for this conversation, but an important one, and really the catalyst for future conversations and future legislation. In fact, I was on the phone late Friday with representatives from the White House who were saying, okay, what's next? I was going, can we just pause for just a minute and appreciate this moment? But that is a great policy effort. The other thing, and I think we've got a slide or two here to share, is I've been part of a group that has been working on a data-informed approach to the top 5 things that every hospital and health system can and should be doing. And I don't know if we can pull up that slide or not from the master deck at the Hospital Association, but let me just tell you a little bit about it while they're trying to pull it up. We are referring to this, if you'll go just to that next slide, we're referring to this as the 2022 Healthcare Workforce Rescue Package, or the Wellbeing 5, as we've now shortened that just yesterday. And let me tell you a little bit about this, because unofficially, this comes from a request, frankly, from the Surgeon General of the United States to be able to get leaders together to say, what are the top 5 things that can be implemented and should be implemented across the healthcare workforce right now? You'll find out more information about it at allinforhealthcare.org, which is a website which houses tons of resources. And I'm also putting into the chat right now a seminar that we gave yesterday, our very first free presentation hosted by the Schwartz Center, about what each one of these 5 is. But I'll very quickly share with you the concept, and understand this is not intended to be the silver bullet for all issues. This is really intended to be next 3 to 6 months what every organization in this country should be doing. So the first is to adjust expectations given the non-normal times, and give clinicians in particular more flexibility and more autonomy in their work. The second is my favorite phrase: get rid of stupid stuff. That's all of the administrative stuff that we burden the healthcare workforce with. You know, interestingly, Tracy, I recently saw a survey that actually was just a few years old from the advisory board, and then another by the AMA, which showed that physicians only spend up to 30% of their time in patient care. Nurses, 50% of their time. That's remarkable to me as someone who's not a patient care, not a caregiver. We have got to free up the time of our workforce to get them out, our clinical workforce, to get them out of this regular conversation around administrative functions and get them more into patient-facing functions. Get radical to shore up staffing, looking at creative ways for frontline teams to help get the help that they need. In fact, one of the things that we discussed yesterday on this webinar that I've just included in the chat is using some of the retired workforce to take on the administrative burden to free up the clinical workforce to actually do that patient care work that they trained for. The next thing is to designate a well-being executive. Now, we know that resources are really tight, but what we don't want to do, and so we don't want to necessarily add resources, but we also feel it's very important to designate an owner of this in the institution. And as we've talked about several times already today, this is not just around individual resilience and individual well-being. Rather, there are significant operational challenges that need to be mitigated and revised. And so this well-being executive should be someone at a C-suite level who has operational authority to make decisions and implement solutions that are operational in nature, not just therapeutic in nature. And then finally, recognize, and I think Dr. Bundy was saying this before, physicians in particular do not tend to lend themselves or utilize EAP services or employee assistance services. And so recognizing that employee assistance services are absolutely critical, and we need to go beyond them. We need to go beyond them to ensure that adequate mental health services are available. And one of the things in particular around there is getting people peer support services. We know that the VHHA, the Medical Society of Virginia, through its Safe Haven program, has got a peer support network. We also know that institutions need to stand them up inside their own institutions because they're very effective. And frankly, those are the things that are being asked for by the workforce right now. So that's all I think I have for my time. We've got a long way to go together, and more information can be found just in the chat if folks are interested in watching a seminar just from yesterday, a free webinar on these issues. So thanks again. We look forward to future partnerships, and best of luck to everyone.
Thanks, Corey. And thanks to all of our presenters. We've put a few websites into the chat in response to the question around Corey's resources and Brian's resources from Duke. So if you're looking for those, before we close out here, take a quick moment to copy paste those into your notes. I did not see any questions in the Q&A, although we did have 2 folks raise their hand earlier. We're very close to the end of our time, but I think we could probably take those 2 questions if either of you would like to put them in the chat in the QA or to speak up now. Anybody from the panel, any parting words?
This is Brian. I just wanted to say thank you for assembling such a great set of examples of how to do this. It's going to take a village, and it's not fixing individuals, and it's not just fixing the system. It's fixing all of it, and making people feel like they have choices that they can use to do things. So I really appreciate you assembling all of this and just being a part of it. Thank you.
Thanks for joining us, Brian. We always enjoy your company, and your programming is so important. I think I see the question in the chat from Rita, although it's moving quickly now in my chat box. And I think it was, there it is. Actually, it comes in from Robin. How is this being communicated to hospital and systems administrators? Most of our institutions were represented in the task force. And what we asked is that we take our recommendations and the commitment to wellness and well-being in our workplaces back to our own institutions for signature and for spread. And so if you are a part of an institution that hasn't seen this come up in your communications or programming, send me a note, send Abraham a note, send Joel a note, and we will make sure that those communications, at least the materials that we've presented here today and the commitment statement, are distributed to everybody. And of course, we don't have the ability to mandate, but we are, of course, making these concepts a standard recommendation, and very much hoping that we all fulfill that recommendation in our own way. As everybody here knows, wellness and joy in the workplace can be culturally connected, and so every hospital is handling it slightly differently, and we appreciate the creativity of our leaders in that space. I think we may have gotten to the questions. There's a question about interfacing with regulatory bodies. Abraham, is there an opportunity to work with our advocacy arm in VHHA on this kind of activity?
Absolutely, Tracy. We have a full advocacy team here at the association that does advocacy work both on the state level here in Virginia, but also partners with the American Hospital Association, with all of the other hospital associations from across the country, so we can speak with one voice in terms of interacting with CMS. So that sort of advocacy work is core to what we're doing here at the VHHA.
Thank you so much, and we appreciate it. Absolutely. We are now very, very close to our time limit of noon. Abraham, any parting words before we move into our intermission, and when would you like everybody to check back in?
So Tracy, thank you very much. I will share this screen. Parting words are, please take advantage of the significant amount of content in the platform. We have on-demand videos, we have a networking lounge, and as we said at the beginning, all of the content in this platform will be available for 30 days. So the on-demand content available now, a recording of all of the sessions will be posted in 48 hours. So please take a break, enjoy yourselves, and come back at 12:30 for our afternoon keynote session. So that ends our session for this morning.